In this video, you're going to get 4 of the best exercises for cervical spondylosis. Cervical spondylosis can cause a lot of problems for a lot of people. It's a degenerative arthritis process that occurs in the cervical spine, which is the neck. It can occur in other areas of the spine, but for the purpose of this video, we're going to talk about cervical spondylosis, which is that degenerative arthritis in the neck. Hi there, my name is Dr. Walter Slubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to stabilize and strengthen your back. Like this, you can bend, move, and lift normally without pain and limitation. So if you want these tips and strategies, be sure to subscribe right now by clicking on that red button below. Like this, you don't miss out on some of the great videos that I put out on a weekly basis. Also, click on the notification bell and you'll be notified when these videos come out immediately. And if you're new to my channel and you just subscribed, let me know in the comments below. Say I subscribed and I'll reply right back to you with a thank you. So if your MRI report says that you have cervical spondylosis, or your X-ray report says you have cervical spondylosis, let me show you what it looks like on a spine model. And then I'm going to put up a picture right here of an X-ray showing cervical spondylosis as well. Here's an example of a normal spine condition or normal spine model. So the discs are nice and smooth. There's no arthritic bony spurs occurring. The joints, the facet joints, there's no arthritis occurring. Very healthy spinal situation. Here's an example of an arthritic spondylosis spine. So what does spondylosis means? It means a condition of the spine related to arthritis or degeneration. Look at the difference here. Look how bony those spurs are, those bony spurs. There's arthritic degeneration at the end plates as well. And then you look at the actual facet joints over here, they're roughed up, right? So if you put them side to side, look at the difference right there, side to side. Okay, big difference, okay? On an X-ray, I'll put it right here, the X-ray, take a look. You'll see all the roughed, bony spurs areas where the red arrows are pointing right there. That's indication of cervical spondylosis. In my office, I've seen hundreds of patients with cervical spondylosis, with cervical degenerative arthritis. And the most common complaints that I see, and the most common problems I see with these patients is, number one, limited mobility. They have trouble turning their head fully, mostly in the rotation direction. In some cases, the maximum rotation is 50%. Other symptoms I see related to cervical spondylosis is stiffness, muscle tension, also pain. So these 4 exercises that I'm about to show you in this video will actually target those limitations, will help with the mobility of the spine for cervical spondylosis, will help with flexibility of the muscles, and generally help to relieve pain associated with that degenerative arthritis, cervical spondylosis. So let's get into these exercises right now. You can follow along or you can watch the video first and then do them later. Now, as always, with any one of my videos, these exercises may not be indicated for you. You should always get checked and cleared by your doctor or primary healthcare practitioner, someone that actually checked your spine, x-rayed your spine, and know for sure that you can do these exercises and that there's no contraindications like an anterior listhesis, a slippage of a vertebra, an instability, something that could contraindicate one of these exercises. So always use your due diligence and be sure you're cleared by your actual doctor to do these exercises. Exercise number 1 is cervical mobility or neck mobility. We're going to target bending forward and back, which is flexion extension, bending side to side, which is lateral bending, and also rotation. So this is what it looks like. I'll step back so you can see. So flexion extension. You can do 5 to 10 reps of these. From the side, go to your full range of motion. At the end range, as long as it doesn't cause any pain. And then side to side, do 5 to 10 reps. Try to get that good muscle stretch in there as well. So with all these motions here, you're getting lubrication along those joints. You're activating those joints and getting mobility in them. Breaking down scar tissue in the joints, along the muscles, along the spine. You can do 5 to 10 of these side bending. Then rotation. Turn as far as you can go. Every turn, go a little further. Turn only your neck. Don't turn your body or shoulders, okay? Only your neck. Bring your chin to your shoulder. Don't do this either. That's cheating. You want to bring your whole neck over to your shoulders. Sometimes it helps to open up the shoulders, palms out, like this. You can work on that slouching posture at the same time. Open up those shoulders, rotate the head slowly. Okay, don't do circles. Pure rotation. Exercise number 2 is a cervical stretch or neck stretch. Take your hand, pull your head towards your shoulders. Make sure it's comfortable for you. Get a nice tension in there, a nice stretch. You can counter pull with this hand behind your back. So this one's pulling up, this one's pulling down towards the floor. Hold 10 seconds. Repeat 3 times. Feels really good. Good. So you repeat 3 times on the same side. Switch. Hold 10 seconds. Repeat 3 times. A variation of this is an angled neck stretch. Turn your head. Take the same hand. Pull on the angle. Counter pull with the left hand. Hold 10 seconds. Repeat 3 times. With every repetition, you try to go further and further. Static hold, no bouncing. Opposite, turn down. Oh, it feels great. 2 more exercises to come, and stay right to the end because I'm going to show you a bonus tip you can do at home, and as well, watch right to the end. I'm going to give you more exercises for cervical radiculopathy, which is that numbness and tingling related to the hands and fingers, which can come from the neck. So stay tuned right to the end. I'll point you to that video in a moment. Exercise number 3 is going to be a self cervical decompression exercise. You're going to need a towel about this length, maybe even longer. You can use a scarf as well. And you're going to hook the towel from behind here under the occiput, okay? So take your towel, hook it under the occiput, look up to the ceiling, and then pull towards the ceiling so you're distracting the cervical spine upwards. And as you do that, sink your body to the ground, okay? So pull up, follow the arrows, and then sink down with your body to the ground, and you get a decompression in there. Hold it for 10 seconds, and then release and repeat. I'll show you from the front. So I'm going to sink into it as I point the hand up, look up into extension, and get a decompression in there. Actually feels very good. You can also do this on a sofa where your knees are on the ground. Put your knees on the sofa, and then you're pulling up like that, counter pulling on the sofa or on a table. Exercise number 4. You can use a towel as well, and you get cervical extension in here. Pull the towel towards the ceiling, bring your head up into extension, and then pull back into the towel. Pull back into the towel, just like that. Pull back, good. Get a good 10 to 15 reps of those. Repeat that 3 times as well. Now, in our office, what we use is this exerciser called a prolordotic neck exerciser. This is the Stroops version. It's an elastic tubing with a sponge applicator here for comfort around the neck. It's a great exerciser, and all our patients with cervical spondylosis and neck issues get this. So nice thing about this is you can stretch it out, and then because of the elastic effect, I get that nice rebounding effect in there. Very beautiful. We do 15 reps of this times 3 sets. That's 45 repetitions. Okay, from the front is what it looks like. I stretch it out, look up, just like that. Okay, nice thing about this is I can do different areas of the spine. I can bring it down like this, target the lower spine. Bring it up, target the middle spine, the fulcrum point. Bring it up even more, target the upper spine, near the occiput or the skull. Also with this, I can do some variations. Pull it out, stretch. I can go across. You get a nice stretch in there. Feels really good. Across like that. That's a really great exerciser for the neck. Now you have 4 great exercises to improve mobility in the neck, flexibility in the neck, to relax tension and tight muscles. Bonus tip, what you can also do after all that routine is get a nice hot pack, put it on your neck, wrap it with a towel so it's not too hot on your neck, put on your neck the hot pack, and then keep that there for about 10 to 15 minutes and just really melt that tension away. And that's a really great way to top off the exercises. Now remember, cervical spondylosis causes a tremendous amount of limited mobility, pain, muscle tension. So these exercises can really help with that. And in some cases, if that cervical degeneration is irritating the nerves where these nerve openings emerge from, where the nerves come out of, then that's now going to cause an encroachment on that neuroforaminal space over there, that neural foramen, and that can cause cervical radiculopathy. So this video right here is a great video to give you some exercises for cervical radiculopathy to relieve tension and also tingling sensations into the hands and fingers. Go ahead and watch that now, and remember also to subscribe. If you have any questions, leave them in the comments below.